Let's bring you some quick facts on the eye-ravaging disease. We do know that glaucoma comes with no symptoms and has no cure. Left untreated, it causes progressive damage to vision until it gets to irreversible blindness. Again, we know that early diagnosis delays progression of the disease. Glaucoma can be managed for a lifetime with medications, surgery and laser treatments amongst other options. Finally, our 2018 data generated by the Federal Ministry of Health indicated that at that time, about 2 million Nigerians over 40 years suffer from glaucoma, with 360,000 resulting to blindness. Dr. Okolo Johnpaul, consultant ophthalmologist, Tulsi Shangrai Foundation Eye Hospital, Abuja, joins me now in the studio to speak on some of these issues. You're welcome to Nationwide.
Thank you very much.
Okay. Glaucoma, we understand, is one of the eye diseases that comes with no symptoms or signs. So how do we detect it early?
Well, it's very important because this disease, actually, I'll start by saying that glaucoma is referred to as a thief of sight. It has no warning. You know, a thief comes in and doesn't give you warning. It comes, and this way glaucoma operates, comes in without warning and steals away your blindness gradually. You know, so in this case, what happens is that creating awareness is very important because it comes without warning. Lots of people present even to our clinics blind already without knowing. They just tell you they wake up and they had this gradual diminution in vision. So it's important to create awareness. Creating awareness is very important in the schools, the children, in the hospitals, in the worship centers and everywhere. And there are diagnostic instruments that are used.
When you say create awareness about?
Glaucoma as an eye, a disease, a pathology.
At what point should I present myself?
At any point, you know, most especially if there's a positive family history of glaucoma.
Good.
You have relatives who have gone blind from glaucoma, you hear about glaucoma anywhere, make yourself available to the nearest eye specialist to have yourself screened for glaucoma.
Okay.
Come in, you know, we check your intraocular pressure, we do a dilated fundoscopy for you, we carry out diagnostic tests as the OCTs, the HFAs, also known as the visual field analysis. These are tests that helps us detect glaucoma early.
Okay.
Because glaucoma has no symptoms. For instance, malaria might have symptoms like headaches and fever, but glaucoma gives you no symptoms.
We also know that research has shown that children around the age of 7 and adults over 40 years seem to be the likely victims. Why is this so?
Okay. Now, it is known, facts have it from research, that as one increases or advances in age, the angles in the eye, they are the angles in the eye known as the drainage angles. It has the tissue known as the trabecular meshwork. So it is believed that as one advances in age, this meshwork, which is responsible for the drainage of the fluid known as the aqueous produced in the eye, it becomes occluded, it becomes blocked as one advances in age. That is why you have it in adults as they advance in age, and from 40 years and above.
Children?
In children, there are the group of glaucoma called primary congenital glaucoma. It's divided further into 3. You have the true congenital, which occurs in children. These children are born with it.
Is it inherited?
Yes. No, they are born with it, yes. There's an inheritance fashion. They are born with it. It's known as the true congenital glaucoma. You have the infantile glaucoma. These occur in children from birth and the age of 3.
So how is that corrected?
Now, they come with, these ones come with symptoms. You know, it said that glaucoma, the thief of sight, comes without symptoms. But those in children come in symptoms. You see a child is born and the child has severe photophobia. That's inability to look at light with excessive blinking of the eyes, called blepharospasms, and also tearing. And some of these children, they have large eyeballs, you know, with megalocornea. And on further examination, you notice that they have breaks in their cornea, known as the herpes striae. So when mothers notice that, look, my pikin no feel look light, you know, it look like with the blinking eye plenty and everything tearing, then they should come.
Okay.
We examine these children further and we make a diagnosis of either true congenital, infantile or juvenile glaucoma.
Okay, are there things that we do as humans that could aggravate this situation?
Yeah, there are lots of things we do. Some people walk into the chemist and just buy eye drops. There are these eye drops known as steroids that cause glaucoma. There are individuals among the world population, there are those that are known as steroid responders. So individuals go to chemists without visiting a proper eye specialist and say, I have an eye problem, my eye is red. And these pharmacists might just give these drugs known as steroids to them. Okay. And these drugs, steroids, can cause glaucoma. Okay, Then individuals or children who have, who generally are prone to, eye injuries. Eye injuries can cause glaucoma also. Then there are some systemic diseases like diabetes that can cause glaucoma. They are associated with glaucoma. But glaucoma also has its main risk factors. What would be
your final word now?
Well, my final word to Nigeria and the populace is please make yourself available for proper screening for glaucoma. Find the nearest hospital that has an ophthalmologist and get yourself screened for glaucoma to prevent its damaging effects.
Thank you very much for coming on Nationwide.
Thank you very much.